Good afternoon, this is Dr. Do again. This video is the quarantine special edition, video number 17. Today I'm going to talk about the viral infection. Since we're in this special time, coronavirus pandemic, we're on the flat stage according to the news, which is good. I think the nationwide, some states watching, some states start to reopen, and since this is a special time, and I think probably it's a good idea to just talk about general the viral infection. First of all, what are the viruses? We already talked about those. Viruses are small micro unit, have the ability to infect people, but they cannot survive by themselves. They cannot reproduce by themselves. Has to be assisted with humans or the host body cells, using the the host cells protein or DNA with their assistant, so the virus can produce, can function, can cause the infection. Basically, they're infecting the cells and use the host cell to make more virus to release. Usually, the viral infection compared to bacterial infection is localized, not that sick. There's a chance how viremia, which means the virus circulating in the blood. If that's the case, then that could be as worse as bacteremia. And unless some special virus, they infect the blood cells. For example, the human immune deficiency virus infect the T lymphocytes, which is in the blood, either the T4 cells, which is helper T cells, to help body to produce antibody against any either bacteria or viral or any other cells. So usually the viral infection just localized. For example, if the respiratory tract infection, the virus attack the respiratory tract mucus cells and then produce cause the inflammation over there. So localized. Again, if it's in the brain, encephalitis is also localized the brain infection. However, the encephalitis could cause the neurological deficit because it's in the brain. And if it's so, that's basically the viral infection. Well, I would just like to talk about the associated with this coronavirus infection. Why it is so serious? Usually, the virus undergoing mutations. Especially their DNA virus and RNA virus. The DNA virus is relatively stable, does not change that much, but the RNA virus undergoing mutations change once in a while. The coronavirus, it's one of the RNA virus. It's the virus caused the common cold. It was like not taken serious, was neglected for a long time because people always, or the physicians or the pandemic or the CDC, they always talk about the flu virus or any other virus going on in the Africa past to the United States last couple of years, like Ebola, etc. The coronavirus is it's a common cold virus, now undergoing the mutations and the change caused the pandemic outbreak. And the worst scenario for this coronavirus is there's a disease called adult respiratory distress syndrome, ARDS. This disease was recognized probably 3 decades ago. At the end of 1980s and beginning of 1990s, it can be caused by like, for example, the toxic shock or the hemorrhagic shock or the severe bacterial infection cause the respiratory distress. If you recall, the lung has many alveoli. The alveoli was wrapped by the capillary, that the purpose is for the gas exchange. The ARDS, it's when those alveoli filled with the fluid, or because the toxins, whatever the cause, the distress caused the alveoli epithelial cells broke, and along with those capillary blood vessels. So that's why the fluid came out to fill the alveoli. That is very serious. Usually occur, like I said, in the toxic shock or hemorrhagic shock or end stage of cancer, severe hypoxia. So this is from the study. Recently, I just follow the coronavirus infection. I follow up, see what is the cause for why the mortality, what's the major mortality cause. One of them is ARDS, which is very serious, and it's hard to treat. And this coronavirus can infect many people from young to old. But from data is either national news or the scientific report, the mortality rate higher in those older people or had pre-existing conditions. So this is the virus. I think the other virus I'm going to talk about is the human immune deficiency virus, because this virus has been recognized probably for 4 decades. Not like other viruses can be treated, but this is why this virus cannot be treated, because it infects the lymphocyte. Like I said, the lymphocyte is the cells responsible for body immune reaction. This virus just infect those lymphocytes, so destroy the immune function. Especially the helper T cell is decreased, so the body cannot produce antibody, because this cell is majorly to help produce antibody. But since this cell is not function well, or decreased number, or decreased function, so that's why that virus cannot be treated. And the other virus infection, hepatitis, for example, is also the viral infection. Hepatitis virus are the DNA virus, hepatitis B virus. It's quite common, probably 3 decades ago, especially in Asia, had high rate of hepatitis B. And now, because the immunization, the incidence rate is lowered, and there's medications for antiviral treatment, is quite available. So that's the other important or serious viral infection. And there's some virus like EB virus associated with cancer, like EB virus associated with the nasal pharynx cancer, or there's special virus associated with the lymphoma, etc., etc. So basically, the virus is the living unit need help from the host cells, the infected host cells, and use the host cell equipment to replicate and to continue the infection. Usually the viral infection, like I said, localized, easy to be managed, exception for those cells infect the immune system, liver, and cause tumor. So this is and how to prevent viral infection: washing hands, just fundamental personal protection, like the currently recommended, wearing mask, washing hands, or flush nose, keep distance. So that's effective for all the virus, especially for the respiratory virus. So that is the very superficial introduction for the virus associated with this coronavirus pandemic infection. I hope it helps, and I'm sure there are a lot of information right now. If you search, just make sure follow the right media, the right data, and to protect yourself. Thank you for watching. I will see you next time.